Hello, everyone. On behalf of UKG, thank you so much for taking the time to join us in our session today, How to Simplify Vaccine Management and Compliance. Today, we'll be sharing our insights and solutions with you, as you all most undoubtedly are dealing with the COVID vaccine management and compliance requirements of today. We can't thank you enough for taking time out of your day for this very critical topic. Before we get started, please know that the session is being recorded and we will send out a recording to you in follow-up. Now, let me take a moment to introduce myself and my colleague, Paige Peeters. I'm Nanne Finis, the Chief Nurse Executive at UKG. My background has been diverse, working in various healthcare organizations for nearly 25 years at a large academic medical center in Chicago, and also doing years of consulting and leading a consulting practice focusing on patient safety and quality. I've been in technology organizations for the last 7 years. And my colleague, Paige Peeters, is a solutions consultant with UKG. In this role, she draws from her deep experience as an HR practitioner to help clients maximize their greatest asset, their people. Paige educates and works directly with organizations to guide them to overcome their business challenges and to make sure they can maximize their UKG solution. Today, Paige is going to walk us through our vaccine management technology solution step by step. Paige and I connect very often with customers and industry leaders, really on a daily basis. We know that technology solutions will support your process no matter where you are in this process. And as you can see in our agenda today, we'll walk through the current state of vaccine management across the US and quickly provide context of the many challenges that we're seeing your organizations and others having to go through now to execute or prepare for this vaccine management process. We will spend the majority of our time, however, with Paige, who will demonstrate our solution that's designed to support you and your employees. Please note, though, whether you're a current UKG customer or not, this solution we will show you, called HR Service Delivery, is a standalone module that can be purchased outside of your core solutions. They are additional products that can be integrated with UKG or any other HRIS system to support HR processes and to better support you and your employees. Please note also that we're going to focus on our US business today and that we are not in a position to recommend one approach or another for you or to give you perspective on the status of the mandate, but we will rather showcase our solution that is available to you quickly and will help for sure help you manage your current vaccine management challenges. Additionally, this presentation is not intended to give you legal advice. This topic, as you all know, and as we know, is evolving in nature with changes happening daily. We recommend that you work with your legal counsel on implementing a policy or process that fits your own organization and your specific requirements. So when you step back and look at this US map, and here you see a mix of vaccinated and unvaccinated populations, you can clearly see the variability across individuals, across states, across regions. And this whole situation really adds an additional layer of complexity to an already challenging process. No matter if you're working to adhere to a federal, a state, or an organization-specific mandate, it is clear that all employers like you must start planning for a new requirement. There's no time to waste. No matter where you are as an organization, we call this period of time a fine balance. You're all trying to run your businesses safely for those who walk into your workplace, safely for all of your employees, and really carry on in a successful way your business future. We at UKG, as I shared, we talk to business leaders across all industries often. And we have found that the process of vaccination management is truly an administrative burden. We see process mapping like this shown on the screen at each step of the process, decision points laid out, and so much tracking that organizations are doing on Excel spreadsheets. Obviously, as Excel is a place to go when you have a lot of data and a lot of fluidity to your data needs and collection, but we know this is not a sustainable solution. Doing data collection and tracking, particularly of this vaccine management process in this way, could really be a full-time job for someone, and I suspect it is for some of your staff in your own organizations. So we're here to really talk about other opportunities to help you with this challenge. So there are so many questions that are affecting you, but also most probably affecting other areas of your own organization, maybe in your human resource area, your IT services, operationally, many challenges. So when you think about what's happening in your own organization, you are most undoubtedly trying to figure out a process that's flexible to meet the changes that are ongoing and also provides consistency and flexibility for your own staff and employees. One organizational leader, physician leader that I talked to recently mentions that, we need to be thinking about this process for the long haul. This is a process that has to be sustained, may take many years. So don't be thinking about this as a one-off process design, but situate yourself to have a sustainable practice in place. So before we jump into our demonstration, we wanted to highlight that this solution that we're going to be talking about is just one pillar of our Well-Being at Work initiative. Organizations like yours and like ours are considering employee well-being as one of our top strategic priorities. I'm sure it is for you as well. UKG helps organizations protect the physical and mental well-being of employees, while at the same time, we help you and ourselves protect the financial viability of our businesses. We also provide solutions that help businesses stay on top of and comply with policies and regulatory and legislative requirements. We are uniquely positioned to provide a set of products that help you protect your organization and to support your people. So HRSD, which Paige is going to demonstrate now, is just one pillar in our Well-Being at Work initiative. We're happy to showcase that for you today. Paige, I'm going to turn it over to you to demonstrate.
Great. Thank you, Nan. Thank you for setting the stage for this demonstration that I'm about to go through. So again, everyone, my name is Paige Peeters, and I am a solutions consultant here at UKG. As a solution consultant, one of the solutions that I specialize in is the HR service delivery platform, which will be the demo for the vaccine tracking use cases today. A little bit about myself before I jump into the software. So prior to joining UKG, my entire background, my career has been spent in HR. So I'm an HR person at heart. So that's where my background all comes from. And so I connect and I talk with many of my peers or former peers in HR or business leaders, as Nan mentioned in the beginning, often. We're having lots of conversations. And as you can imagine, the topic of conversation as of late is always about the vaccine tracking and about the mandate and how this complex, challenging for some organizations process is really creating a lot of tough conversations internally, and how can we simplify something that is so complex. And so my goal today, my goal for the demonstration, is to show you just how HR service delivery, how technology like HRSD can help you simplify such a complex and challenging process at your organization. And so let's start. Let's start by talking about HR service delivery. You may be asking yourself, what is HR service delivery? Where does this fit in? How does HR service delivery fit into my current technology offerings at my company? And so I'm here to tell you that HR service delivery, it picks up exactly where your HRIS leaves off. Like Nan mentioned, whether you're a current UKG customer or not, HRSD is designed to be an extension of your HRIS. When you think about your HRIS, it's already full of so much data. It's full of data like your employee information, the demographic information that you might need, the organizational structure, such as who reports to who. What does that org chart look like in your organization? Data like HR users, permissions, security, who can see what, who can edit what. All of these core data points that live in your HRIS system today, HRSD takes advantage of. HRSD takes advantage of that to create a personalized experience for your employees. Not to mention, don't want to forget Document Manager. So we'll talk about documents today. So with Document Manager, we can also integrate with your HRIS or any other systems that you have today and centralize all of your employee documents. Now, another question that I'm getting often when I start talking about HR service delivery is this a new solution? Is this a new offering that UKG has to assist with the vaccine mandate? And I'm here to tell you, no, it is not. So HR service delivery is a proven solution. We have over 2,500 customers on HRSD today globally with us. The vaccine tracking use case is simply just a scenario that we knew our customers needed help with. And so we built out those scenarios to assist. And so that's what we're going to demo today. Specifically, these are the use cases that we'll be highlighting with HRSD. We'll first take a look at that employee who's fully vaccinated and ready to submit their vaccine card. Then we'll take a look at what happens when you have employees who want to submit an exemption request, whether it be medical or religious. Then what happens on the receiving end of that request when it's reviewed and approved, and then they need to undergo testing, whether it be weekly testing, for example, and provide those negative test results on a weekly basis. What happens when an employee tests positive? How does that affect and how is that managed in HRSD? Then with points 4 and 5, that's where we're going to take a step back and we're going to look at what does it look like on the administrator's standpoint from HR, from safety, from a manager. What does managing of that request look like? And then we'll tie it all together at the end with some advanced analytics and reporting capabilities. How can we capture who's vaccinated, who's not, who's completed their weekly tests, and we'll round that out at the end. Okay, so this is our framework for the demo for today. I am going to go into our first demo use case now, and as I go in and demo live software, I am going to go off camera just to avoid any distractions. So let's jump on in. Our first use case, our fully vaccinated employee, and I'm going to use Kelly Peterson to show you what we can do when we have a fully vaccinated employee like Kelly here who's ready to submit her vaccine card. We're brought out to Kelly's employee portal in HRSD. She's ready to submit her vaccine card, and all she needs to do is search. It's like a Google-like search. She comes out here and she searches for vaccine, and she's looking for any related policies or any content that your organization has pushed out, and she can see simply, oh, there's my vaccination self-reporting form. So she just simply clicks into that form. She's brought in, and she can see very clearly the required fields that she needs to do. She can either snap a photo of her vaccine card or just grab the photo from her phone library and upload it right here, right from her phone. Now, the following items that she's filling out here, the vaccine provider, whether it's Moderna, Pfizer, or any others that you might have on this list as this continues to evolve, the vaccine date, the vaccine numbers, all of these items that we're capturing right here in this form, these are configurable to you. You can ask for as much or as little information upfront as you would like. If there's a field you're not seeing here today, know that it's something that can easily be added without needing IT's help to configure it. So as she's continuing filling it through, she reviews, makes sure everything looks okay. And now once she's ready to submit, she hits send, and she knows that that request is automatically routed to the administrator, HR, or manager for review. At any time, Kelly can go into her request and she can review and she can be confident that her vaccine card and her data was successfully submitted and sent over to HR or your administrative team to review. Furthermore, continuing to automate this process for her, Kelly can be confident that that vaccine card, her record card, is automatically going to be filed in her electronic employee file as part of the process. Document Manager knows exactly what folder to file the card in on her record based on your configuration. So there's our first use case. We had our fully vaccinated employee snap a picture of her vaccine card, and she sent it along its way. Now, please note that if Kelly were on her desktop or on a laptop or even on an iPad, it's the same experience. So if she has an image saved on her computer of her vaccine card, she could upload it there. Same experience no matter what device your employees are using. Let's move on to our second use case. Our second use case is we have our employee who's looking to request an exemption, whether it be a medical or religious exemption. We're back to the employee's portal. They go out and they search for vaccine-related information, and they go down to that same place where they saw they could self-report their vaccine card, and now there are forms to fill out for these exemption requests. Now, whether it be medical, whether it be religious, you can combine these forms, you can separate these forms. It's completely up to you, again, what information you want to ask for on the front end. Do you want to have certain items required? Do you want to require a document attachment? Do you want to require contact information or manager information? And one thing that we're seeing a lot of customers want to do is make sure that they're including policy language. So we see that policy language there and that acknowledgement, that electronic acknowledgement that I have read, I've understood the policy, and I'm submitting my request for exemption. Again, once submitted, Kelly or any of your employees can go in, can view the request, and furthermore, they can communicate. They can communicate directly with the administrator on the case. In this example, Kelly is going to be looking for an update. She's going to be wondering if her request is approved, if it's denied. So providing them the vehicle to communicate directly in text format like this is critical. And I want you to picture, what is this taking place of? This message to HR is taking place of a phone call. It's taking place of an email. It's taking place of an employee stopping by the HR office asking, what's the status of my request? All happening in one centralized location. Now we're going to fast forward. So this exemption request was submitted. We're going to assume that it was approved. Now that it's approved, we're going to go on and understand that this employee needs to comply with weekly testing. So as an organization, your organization has the utmost thought and concern, not only for her safety, but the safety of others. So the weekly COVID test is a requirement. Now, Kelly knows that she could go back into her employee portal, those use cases we just saw, and she could submit a form with her negative COVID test. But another way that we're hearing many of our customers make it that much easier is by having QR codes. So by leveraging a QR code that can directly link to the form for her to submit her negative test result. Now, in today's world, QR codes are everywhere. It's rare you go to a restaurant and they don't have a QR code to access their menu through it. So it's not unusual for your employees to see a QR code to go through a process like this. Let's walk through what that would look like. We have the employee, they just grab their phone and open up their camera. All they need to do is snap a picture of the QR code, and it takes them directly to the form that they need to fill out. They're brought right to the form, and you can see here as an employee, she has two options. Did you test positive or did you test negative? She can put in the test result date. And again, as she continues through, we have that acknowledgement checkbox, understanding, yes, this is negative, and yes, I will submit another test result in 7 days. She can go out and she can grab her test results, snap a photo, whatever it might be. She can upload those test results. Very similar, consistent process across the board, and send it along its way. Now, again, adding that policy language at the end, making sure you're communicating with your employees as much as possible on what your policy is, and making it clear that in 7 days, that employee needs to come back and request and upload another negative test result. She's also confident that her test results that she's uploaded here will also be automatically archived in her employee file. So we saw with the fully vaccinated employee that we automatically archived that vaccine card on their employee file. We can also archive the test results on an employee file, and we'll show that from the administrator view once we get further on in the demo. Okay, so now honestly, up to this point, I would say we've covered the best case scenarios, if we could call them that. We had our fully vaccinated employee. We had an employee who requested and was granted an exemption. After that exemption was requested, they did their weekly test. They tested negative and they uploaded it. But now for the remainder of the demo, I do want to focus on what happens when we have an employee who tests positive, such as our employee right here, Howard Edwards. So here we have Howard, and Howard has tested positive. So we're going to step into Howard's self-service portal, where we just saw Kelly submitted her test results. Howard now will submit his positive test result. But before he does that, he wants to know a little bit more about the policy. What does it mean now that he tested positive? How long does he have to be out of work? How many additional tests does he have to take? And so he searches for the policy. And you can see that that first result is the policy. And so he's going to read through the policy that was published by your organization so he can understand, what does this all mean before I submit my positive test results? Now, as he's reading through the policy, I just want to make a note. This content is created and pushed out by you. So it's very easy to edit and maintain for your HR team. You can embed images, videos, links. It's extremely user-friendly with no IT or marketing involvement needed. It's clear inside the form where he submits his weekly test results. And he's brought to the form, just another way of getting to this COVID test result self-reporting form. Now, instead, he's just going to select positive instead of negative. As he selects positive, I want to draw your attention to the bottom of my phone. The bottom of my phone, notice that red language that unfortunately you submitted a positive COVID-19 test result. And due to this, you are not allowed to work on site. Had Howard selected negative, as we saw with Kelly, that policy language would not have shown up. So this form has conditional logic. This form is smart enough to know that when you have an employee who says, I tested positive, that you can insert those warnings. You can insert your policy language of reminder, please do not go to work. Again, you're just enforcing the safety measures to make sure that your employees who are testing positive are not coming to work. Same process, going out here, grabbing those positive test results, attaching it to the case request, and sending it along its way. It's very clear to Howard he cannot go into work. He's reminded that he needs to touch back in 7 days. Now, a lot of times when we have a situation like this where we have an employee who tests positive, this simple case request that we just went through might not be sufficient enough, and there might be more tasks that are assigned to him. So now we're going to navigate to Howard's tasks, and we can see that there is a policy acknowledgement now waiting for him to review and approve. Now, tasks can vary. They can be a policy acknowledgement, or it can be any other follow-up documentation that might be required of him. So in just 2 clicks, Howard can come in here. He can read the policy on what happens now that I tested positive, and he can electronically agree and understand the policy. That document then being archived in the employee's file. Furthermore, it's clear to Howard that he has the task that he has completed and the task that he has yet to do. It's clear that he needs to submit a new COVID-19 test result before he can come back to work. Taking this a step further, this process that we're looking at here for Howard, it's not only limited to what we need from Howard or from your employees, but you can include others in this organization as necessary, as it's a multi-step, multi-stakeholder process. Now, we'll get to see the entire process with those other stakeholders added in, like a manager or an HR team, when we log in as an administrator here in just a minute. So we have our employee. Our employees tested positive. What happens next? The administrator's point of view. So we're going to round out our demonstration here with the administrator point of view. And like I said in the beginning, this could be HR. This could be a COVID response team. This could be a manager. This role and the overseeing and the management of these cases and of this process is really up to your organization and what you've defined as who's going to oversee this, especially from a compliance perspective. So we'll take a look when we're in here as Linda Hudson, as our administrator, what does it look like on the receiving end of some of these requests? And so to do that, we're going to log in to her request manager dashboard. So we're logged in here in HRSD into the request manager dashboard. And what we're brought to is any items, any requests that have been assigned to Linda. So when she logs in, she can see everything that she's responsible for. And that is made possible through the business rules engine. So your team, your organization can ensure that these cases are routed to the right person or the right group of people, as you can see here. And we can even establish a service level agreement from the very start. We can decide that this is urgent, and we can decide that we have X amount of days to finish out this case. Now, I want to take a pause and I want to tell you what this screen means to me. Coming from HR, when I was in HR, we used to have a shared email inbox for our HR team. The email was hr@companyname.com. And in that inbox is where we received any question, any request, any concern from employees. And we had somebody who monitored that email inbox. And then they would forward out the different requests accordingly. If it was a question on benefits, they would forward that to the benefits team. If it was a question on payroll and my pay statement was wrong, they would send that to the payroll team. I envision that many organizations, actually, I know because I've had these conversations, I know that many organizations are leveraging a shared email inbox for some of these processes related to COVID today. And I'm here to tell you that that's not the right place to handle something like securing of an employee's vaccine card or of test results. Being able to leverage a request manager and this dashboard that we're looking at right here will not only be easier on your HR team who's managing up those requests, but it'll help you with the ability to report on and be able to keep up on everything and make sure nothing falls through the cracks. And now again, we're focusing on the vaccine specific use case today. As you can see, my dashboard is full of vaccine cases. But keep in mind that HR service delivery really can be used for other use cases if that's something that your organization wants to explore later on and down the road. So let's go into this test result self-reporting from Howard. So we just saw Howard, our employee, who submitted his positive test results. There's a few things I can do on the receiving end as HR. I could take a look at the image, I can review, I can approve, I can communicate back with the employee. As you can see here, there was his question on when can I return to work. I can use pre-configured answer templates. So ensuring that your HR team or your administrative team is responding in a consistent and compliant manner will help you avoid any concerns around discrimination when handling these cases. We have the ability to communicate internally. What if I want to communicate with my peer, letting them know I'll handle this case, making it very clear to their peers that I've got this covered and I will communicate with Howard until he can return back to work. So as the administrator, I review, yes, indeed, he did test positive. I'm affirming that, yes, this is positive. And now what's happening on the back end is this is creating a much bigger process. So sometimes requests, as we just saw, trigger larger processes where we have that multi-step, multi-stakeholder involvement. So right here is where I want you to think back to Howard when he had that policy be sent to him because he tested positive and he needed to review and acknowledge it. That's exactly one of these steps in this process that you would want to happen. Other stakeholders you might want to be notified as a piece of this is maybe you want to make sure the manager is aware so that the manager knows that I'm not going to have Howard. I can't schedule him for the next couple of weeks. Let's send an email notification to the manager and make sure he's aware. Let's send an email notification to the leave. Now, we understand that just because an employee tests positive doesn't mean that it's a leave of absence case. However, this is covering your bases. This is helping you remain compliant and making sure that your leave team is aware that you have an employee who tests positive and this might be a potential leave of absence case. There are many people who will get affected when one employee tests positive. And so having a process like this to be able to make sure that nothing is missed and no steps are left behind is critical. But as we all know, and as Nan mentioned in the beginning, things are changing. This is a living and a breathing process. There might be times where you might have to add in a task. You might have to add in an acknowledgement of a document or a signature of a document. And on the fly, the ability to do so is very easy for your HR team. So let's say we want to schedule a follow-up test. We want to schedule a follow-up test and make sure that Howard, before he returns to work, is wrapping up or doing another test and getting 2 negative tests before he turns to work, for example. You can assign who is responsible for monitoring the task. You can even have the tasks be dependent on one another. So for example, I would want to make sure that he submits his first negative test result before we have him go and do another negative test. You can assign a due date, and you can even assign notifications. And when do you want those notifications to be scheduled and sent out as a reminder? So in just a few clicks, you can see we added a task right to this process for the employee to make sure that they're doing their follow-up tests. Now, something we haven't spent a lot of time on yet is the documents. I've talked about them. I've mentioned the documents that are being captured along the way, the documents like the vaccine card or like the test results. But it's important I note that any documents that are being generated or captured as a result of these processes are automatically or can be automatically archived to an employee record. If you want to add an extra layer of review, documents could be routed to shared inboxes in the workplace for additional review or audit before filing on the employee's record. But let's show you exactly where these documents will be living on an employee's record. And to do that, I'm going to bring you to Howard's electronic employee file. So this is Document Manager. Document Manager, again, one of those pillars of HR service delivery, and this is where those documents are being captured and stored along the way. You can see the specific folder for COVID-19 for healthcare, and we can drill in and we can see the items that are being captured as a result, whether it be test results or the exemption documents or forms or the vaccine card. All of these documents can be stored right on this employee's folder in their COVID folder. Now, something that's important to note here is all of these folders are security based. So if you're thinking there's only a certain amount of people or certain people that you want to have access to the COVID vaccine related documents, we can control that. All of these folders are security controlled, depending on what fits the needs of your organization. So I hope you found value now in how UKG HRSD can help you with your processes and how we can make sure that those requests are being routed and those documents are being stored. But a piece we haven't talked about is we still need to ensure that you're remaining compliant. It's a lot of moving parts, and not to mention, it's for your entire population. And so for now, we're going to round out the demo with what's available from an advanced analytics perspective. What dashboards, what analytics is available for you to make sure that you're able to manage this for your entire organization. So HRSD allows you the ability to create custom visualizations and dashboards to be able to monitor your progress and status. So you can see any of the vaccine providers, we can see any of those test results, self-reporting. Everything we've covered in the demo so far boils up to this screen. We can get creative. You can look at bar graphs, line graphs, pie graphs. You can see in a map view of where in the organization are these positive tests coming from, or where in the organization are most of your employees submitting their vaccine card. You can be drawn to any action items. So I can see here I have 5 exemption requests calling my name that I need to drill into, and this is interactive. So if I clicked on this, it would bring me right to those requests, those exemptions that I need to review and approve. And then lastly, again, that last piece of the demonstration we just looked at, the documents. It's extremely important for compliance reasons that we are capturing these documents, these vaccine cards, these test results, or any of the related documentation that goes along with this entire process. So you can see document count by location. You could look by position. You can really slice and dice this data any way that makes sense for your organization. But if you're not seeing something that you would love to report on, I want to direct your attention to this Explore. And notice that there's all sorts of different fields we can bring in to report on. For example, employees without documents. It's great to be able to report on your employees who have uploaded their vaccine cards or their test results, but it's probably even more critical that we keep tabs on who hasn't uploaded their documents. Okay, so very robust reporting capabilities within the advanced analytics. And then I want you to, over here on the right-hand side of my screen, if you're thinking of any executives in your organization who you don't think will come in here, who you don't think will come in and want to review these dashboards, but they're going to want the data. They're going to want to understand percentage of employees who are vaccinated or not, percentage of employees who are testing positive or not. You have the ability to download this data into PDF or CSVs, and furthermore, you could send it. So if you know there's somebody who you're going to want to send this data to on a frequent basis, you can do so. And matter of fact, you can even schedule what that frequency looks like. Maybe every morning at 8 a.m., you want one of these visuals sent to an inbox. We can do that all from this screen. So the advanced analytics portion, you can create these on the fly. You can update them at any time should you want to change what you're monitoring at all. So to wrap us up here, we just looked at HR service delivery. We just looked at how HR service delivery can make what is a seemingly very complex and challenging process and how we can simplify that for you. Our goal is to put your policies into action, and we understand that these regulations are constantly changing. And so that's why a solution like HR service delivery, with how flexible it is, can really help you with these policies and putting your policies into action to not only automate, but operationalize for your entire workforce. To wrap up what we looked at today and those specific demo use cases related to the HR service delivery vaccine tracking, we looked at the employee who submitted their vaccine card. We looked at the employee who submitted a medical or religious exemption request. Then we fast forward and we assume that that request was approved. What does that weekly testing look like? And how do your employees upload, whether it be a negative or a positive test result? We showed you how you could use QR codes in this process as well, making it that much easier for your employees. Then we rounded out from an administrator point of view when we logged in as Linda Hudson, and we showed you how can she manage all of those requests coming in. And furthermore, how can she manage a bigger process, a multi-step, multi-stakeholder process to ensure compliance for the organization. With her, we also looked at the document piece. Where are these documents being stored? And lastly, how can we report on everything that we've covered today? Whether it be the requests, whether it be the documents, or whether it be the processes, tasks that are left undone. The advanced analytics module will be able to provide you that holistic view of what's going on in your organization as you're navigating these challenging times. And so with that, I want to thank you so much for listening to my demo, for walking through that with me. And I'm going to pass it back over to Nan, invite Nan back, and we're going to talk about next steps and wrap us up. So thank you.
Thanks, Paige. What a wonderful demonstration. And you made it so clear and step by step. So thank you so much for that. And I think, as you step back and think about the solution that you've just seen, a couple of things really struck me, and I think probably strike you as well, is that this is simple to implement. We believe it's very simple and intuitive to use. It doesn't require any other UKG product or any existing HRIS or configured HRIS system or ERP system. We are agnostic to that. Given then the critical nature of vaccine management and what's happening today, we know that you need and we need an efficient process to collect data, submit data, and really effectively communicate with your employees. So we're very, very excited to showcase this product. We wanted to leave you with a couple of points just as highlights. We have an expedited implementation available for this HRSD product. And as Paige described, two pillars or two modules in HRSD called People Assist and Document Manager really are the core product that we're talking about here today. We can implement these in less than 3 weeks of time. And as you have heard, this product is agnostic to any solution. So essentially, we can plug into any HRIS system that you have. So given that, Paige, I know we have a couple of questions that we often hear and thought that maybe we could, kind of talk about those that are most frequently asked and perhaps go through a few of them if it's okay with you.
Sounds good. Let's do it.
Okay. So the first one really is from an employee's perspective. You demoed the primarily the solution on a mobile device. What is the experience if I were to look at a desktop view or other views? Could you speak to that, Paige?
Yeah, so that is a common question we get. Yes, I demoed a lot from mobile today. I demoed that submitting of the request, especially that employee view I showed from mobile. But do know that it is the exact same experience, no matter the device that your employees are on, whether it be an iPad, whether it be a laptop, desktop, it is a device responsive and device agnostic application. And so it's that same experience no matter what device your employees are on. So really good question. Yeah.
Okay, thanks, Paige. And can you again emphasize and describe the products that are required for the basic vaccine management solution that we were showing today?
Yes. Yes. Okay. So HR service delivery, the specific modules as part of HR service delivery are document manager and people assist. And I just want to be clear of where I showed those modules that might help. So let's think about the demo. We looked at the use case of the employee uploading their vaccine card. That request is using People Assist for the case, and then the vaccine card is being stored, and so that's the document piece. Okay, so we looked at Document Manager, People Assist, and then we looked at Advanced Analytics at the end. Again, this is all specific to the use case of COVID vaccine tracking. I know that at times during the demonstration, I talked about other use cases that you could maybe grow and expand on, but do know that that is outside of that 3-week time to value that Nan was talking about. Our goal, first and foremost, is to get our customers up and running, compliant with the mandate requirements. And so that is specific to the vaccine tracking use cases. So that's probably a longer answer than you needed, Nan, but I just wanted to make sure that I was clear about what's included in that really quick implementation. So,
Thanks, Paige. And how does this solution interact with with current technology?
another common one we get. So HR service delivery, although a UKG product, you do not need to be a UKG customer to leverage HR service delivery. So the key piece is that we'd want to identify what is your HRIS or what is your source of truth for people data. So where is your employees' demographic information stored? How about the organizational structure? And then again, thinking about HRSD being an extension of your HRIS. Okay, so HRSD picks up where your HRIS leaves off. And to go over those core data pieces again that we would use the employee data, org structure data, and any of the permissions, the HR admin permissions data. Those 3 pieces of data are critical when getting you set up for HR service delivery, no matter what HRIS you're on today. Now, I'm just going to expound on that a little further because another question that we usually get when we go down this topic is, well, what if I have any other desired integrations? So anything beyond what we've covered today, any other desired integrations or interactions with any of your current technology would just need to be assessed on an individual basis. And again, just to be clear that anything of that nature would be above and beyond that 3-week expedited implementation timeline. So case by case.
Thanks, Paige. And I think that's all we have time for today. It's been a pleasure, and thank you so much for your expertise and for sharing that today.
No problem. Thank you, Nan.